Research from 2020 showed that 41.2% of employees working from home reported lower back pain, and 23.5% had neck pain. Of the patients with neck pain, more than 50% reported neck pain exacerbation while working from home. Stay tuned to learn how to help patients save their spines while working in their at-home workspaces. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute, and your host on the Virtual Ergonomics Summit. I'm honored to welcome you, our next guest. Dr. Alan Chong, known as the Spine Doctor, is the director of Calgary Spinal Decompression Center and Center for Chiropractic Care. With more than 30 years of clinical experience, Dr. Chong also hosts a podcast called Practice Mastery for Chiropractors. Today, he'll be discussing ideal posture for your home office. Dr. Alan Chong, please take it away.
Thank you very much, Dr. Krista there. I'm very happy to be presenting my unique slant on posture ergonomics, and I want to show you as practitioners something I teach many patients, and especially the in-office patients. Now, as you know, right now, Dr. Burns, there's so many people working at home, at least here in Canada and many places in the world. So I think this is very applicable to talk about the topic of posture and ergonomics for the home environment. Now, what's unique about the home environment? Usually, what things do we know? People don't have an ideal setup. They're often working on a laptop, and I'm on a laptop right now. So later on in the presentation, I want to show you some practical aspects, and from a different camera angle, I'll be using my phone, and we're gonna try to show you the dynamics of showing what I call the posture self-check. This was something I came up with years ago to teach people what ideal posture is. So, but before that, of course, I want to emphasize the fact that we have different work setups for people at home. Some people have a great setup, which I would say is exceptional. Some companies have supplied their employees with some ergonomic setup and their chair, but most people have their regular desk or tabletop. So how do we deal with that? Well, first of all, I always teach ergonomics, and I recommend you do too, using some protocol. My protocol is called the posture self-check, and that is simply getting up against the wall, and I'll just walk you through this first, and then we will demonstrate it later. So up against the wall, and there's basically three body types that I show this to. People that are relatively slim and can actually touch their head back to the wall. So it's basically your back and heels and everything against the wall. Well, you know, as professionals and posture professionals, you know that not only do the postures vary, but the anterior head carriage might be so severe that they cannot possibly bring their head back to touch the wall. So I give the leeway of one hand space, but behind the head as one option. And then for those people who are either quite muscular or very advanced anterior head carriage, they may have the leeway of at least having a fist behind their head. So in other words, what we're trying to do is establish for the patient where you want their head position to be. And why is that important? I find that most ergonomists, and I work at my downtown clinic, we work with mostly corporate people. And so what I almost always find is the ergonomist has gone through their review, and guess what? I don't like the positioning, right? And you may find this too. And why is that? The most common problem with that is that the ergonomist, and if you're an ergonomist, you know, maybe you are doing this, and if you do, awesome, is define ideal posture for that client first. Second is help them establish that ideal ergonomic or posture position so that they can find ideal ergonomics. And then third, set them up how you'd like them to set up, and then create the environment, obviously with the sound ergonomic principles. So posture self-check, I will demonstrate that towards the end of the presentation, but right now I want to cover some concepts. So Desktop application, obviously, I'm not going to be exhaustive in my presentation, but we know the factors are that there may be stuff around, their desktop may be just set up on a kitchen, a laptop on a kitchen table typically, or worse, they're working at their coffee table, or even worse than that, they're just slouched over the couch working on their laptop. Those are obviously situations that need to be addressed. But let's consider a desktop first. The most common thing I find is the monitor is too low. And so when we define that posture self-check, and let's say we've just defined it now, and define that ideal posture for the person. Well, my personal recommendation, and it's a bit of a disruptor viewpoint, is that I want the monitor, whatever size it is, at eye level for the middle of the monitor. And so I ask the client to err on the side of a monitor that's too high. Now the exception is if they have transitional glasses or readers. So they're up like this, right? Which is straining their neck, obviously, right? We've seen this. So obviously the practical suggestion for that is to get dedicated computer glasses. That's one. And that will help solve some of the situation. The second thing is, of course, have them show you where the monitor is, and then in most cases, raise their monitor. And for the most of the time I say, get binders, get something temporary until you can get a more permanent fix, but make sure it's safe. So safety, of course, that. So desktop application, same thing at home. Well, guess what? Most of the time, their desk is not adjustable at home. Certainly mine isn't. So what do we need to do? Adjust the chair height, and the obvious thing, of course, is to get them to use some type of footrest to get that 90 degrees plus or minus 10 degrees at the knee angle, so for comfort. So assuming you've got those things in line, that's obviously a much better desktop situation. Now, what are we finding? A lot of laptops up there, right? So, in fact, I'm on a laptop right now, and the situation is the monitor is too low. And here's the general rule I say. Well, if you're going to flip open your laptop only for 10 or 15 minutes, well, tilt that screen down so it eases your neck angle, and then use it like that. But if you're going to be working on it long term, obviously we want to recommend that they lift up that monitor. Now I've got a box here, so obviously I'm going to slide that box under right now. I've got a stack of magazines, but that is not enough. So I'm going to do this right now here on the fly, and obviously adjust my position. And I have a separate keyboard and separate mouse. So that's my rule in the clinic. If you're working with me, separate keyboard, separate mouse, and your laptop, whether it be a wireless or wired, doesn't really matter, whatever your comfort. So obviously, now when I go out like that, the monitor of the laptop is at eye level with the posture self-check position. So just a quick review of what we covered so far. Establish ideal posture for your client, because let's face it, most people do not know what ideal posture is. So define that for them, and then proceed to define the ergonomics that they need to maintain to ease their discomfort, obviously decrease the wear and tear in their spine, and to help them be more comfortable. And more comfortable usually means more efficient and less headaches and less degenerative problems. As we know, degeneration in the spine is a huge problem, and pre-existing degeneration will not just go away. And so many workers and people are suffering from neck pain and back pain due to those factors. Now, that brings up a question. What about the kids? Same principles apply, don't they? So, Dr. Burns, for the kids, to be astute and to provide that extra service, ask about if they have kids, and ask about, do you notice this, and get them to apply some practical tips that they can hopefully encourage their kids to be more um, watching out for posture and posture self-check. So when I show the posture self-check, this is I often show families this, and so that there's that cross accountability, and there's that knowledge of where ideal posture should be. So for the laptop, a couple other considerations I like to offer is that, most people don't know where their arm position should be. So when I show that posture self check, the arms are, of course, should be at 90 degrees in the relaxed position, with the arms hanging down from the shoulders. So I'm going to show you here, right here at my station, seated, so that this is a tip, of course, that you can give, is just to let your arms relax. Now, what about the armrests? I actually recommend that most of the time they don't use their armrests. Now, for some chairs, that's impossible due to their habitus, their posture, and such. So, as a minimum, they need to sit to the back of the chair, uh, arms relaxed as best as possible. They may even need to remove their armrests, so to establish that 90 degrees with their arms for their mouse and keyboard. Obviously, this is something that we want to encourage to them to incorporate in the laptop position as well as the desktop, and that's going to give them a lot more comfort. They're going to be thrilled with that advice. And then, of course, the extra step is, and at the beginning normally, is to define their ideal posture. So I think we should move to that, because we're going to have some Q&A after too. But I think we should move to the posture self-check. What do you think, Dr. Burns?
Sounds great. Let's do it.
Okay. All right. So I am now against the wall with my heels touching. Now, you can give some leeway to that so it's a comfortable, natural position based on the person's body shape and type. But I'm against the wall, and for me, I'm relatively slim and I get adjusted regularly, so my neck is flexible and I can easily touch the wall with my head. So the position is right there like that. So posture self check not only is that, so that's one. Number two is the shoulders nice and relaxed, and the arms at 90 degrees, just in a relaxed position, and then in the nice upright position. So basically, it's a very quick ability to check. Now, I mentioned at the start of the program that you can put one hand as a spacer there if you need to, if the person needs to, just to be a spacer. If they're really head forward or really muscular or such, then the whole fist back there, so that you can actually use it as a spacer. You decide as the clinician to teach the client the perfect posture, ideal posture. And I call that the posture self check. So a quick review of that is back and head against the wall, use the spacer accordingly, arms totally relaxed, and 90 degrees at the elbows when you're finding the keyboard and mouse position. So let's bring that over to the workstation, where we will summarize what to do again with the posture self-check. So here's my little setup here, where I put it on a box. Obviously, it's not rocket science, and it's just getting the client to use certain practical things that are secure and safe, so that they're not going to fall over and they can easily set it up. Now, I'm not going to show you this, but the other obvious position that really works well is the kitchen bar area, where the laptop can go on the upper counter, and then they can stand. So a great tip is to set up that standing type setup with the same posture self-check recommendations, and of course, looking straight out, so that in the posture self-check ideal head position, then the hands, the middle of the hand is at eye level, representing where the monitor should be. Okay, sounds good.
Well, thank you so much for showing us that posture self-check. So just a quick summary of a couple of important points and a couple questions for you. You
Hmm.
mentioned to perform the posture self-check standing against the wall. Three different body types are more slimmer individuals can touch the back of their head and the back of their body against the wall with their feet pressed against the wall as well. And then the next type would be one hand space behind the head and then a fist behind the head. So we want to evaluate
Absolutely.
where the patient is and teach them how to perform this so they can perform it at home. And when it comes to giving postural ergonomic recommendations, you always mention defining ideal posture first, and then set them up and create the environment with sound ergonomic principles. Some great examples that you gave, some practical application for your patients, is to make sure that the monitor is not too low. Have dedicated computer glasses if they feel like they're looking back to look below their glasses. Dedicated adjust the chair height and use footrest. So making sure that they have the proper amount, so they have a proper chair that's supporting their spine upright as well as they can touch their feet on the ground. Separate keyboard and mouse, very important for keeping the elbows and the upper extremity at a proper position. Now, Dr. Chong, a couple questions for you. You mentioned that in your practice you work with primarily corporate workers. So as you're working with corporate workers and you're getting results with them, how do you recommend utilizing the current workers that are coming in as patients as a way of creating more referrals among other
Hmm.
colleagues within the corporation to create the conversation, maybe go on site to do an ergonomic evaluation and or generate more referrals?
Right. Great questions. One of the obvious things when you teach someone ideal posture and ergonomics, for some reason, that's novel. That's new stuff for them. So obviously, if it's new to them and they're noticing an improvement in those results, then certainly just ask for referrals in the sense that, do you know some other people in your department or otherwise that could really use this type of advice? And if so, then I'd be happy to do a posture self check with them and teach them that.
And when you do a health fair, for example, are you doing the posture self check at the health fair so that patients can see it and feel it in real time, or what does that communication look like?
Absolutely, that is a great little tool if you're not fully equipped with this with the grids and the whole bit. If you are, that's even better. But often that's for you to see, and they don't see it, right? Other than the fact that if you're using a mirror and stuff, but really low tech methods where you can teach them, and that's why I created the posture self check for that practical purpose, both as a show and tell and as a very practical educational tool that can be taught within 5 minutes.
Mhm. Great. And when it comes to educating your patients, let's say, day one, day two, and then throughout their treatment plan, what does your education, your ongoing education process look like? Is it table talk in the office? Do you send emails, videos? How do you educate your patients to help them implement these ergonomic tips during their treatment plan?
Well, that's a great question too. I mean, my style is each time I want to engage them. For one, I mean, my patients are in for different reasons. Many of them are on maintenance once they're out of crisis, and whether it be a stiff neck or such. And my programs mostly are corrective, so that we have a schedule of follow up and such, and obviously we want that compliance. But the most important education occurs, I would say, in that first 5 visits, and then your 10 visits and beyond really are to continue to establish relationships. So my I use the posture self check and as something of an accountability tool as well, right in those first 5 visits. Again, the number one thing I learned is relationship building. And when they have that trust of you, then they're going to trust your opinion. And then when you can prove your results, that's what posture self check is, partly to prove your results in situ in their actual office clinic. When they come to the clinic, then it's like it just makes sense.
Of course. Well, thank you so much. Dr. Allen, where can we learn more from you and tune into your podcast?
Well, the podcast is available on all major podcast providers. It's look under Practice Mastery podcast, Practice Mastery, and I invite all practitioners. It's not just for chiropractors. I have a whole host of guests from all different fields in that. And we don't just talk about one thing. We don't just talk about spine. In fact, we talk a lot of business. We talk a lot about inspiration, and we talk about our whys. And I just encourage you to help people right now, serve them well, especially serve their families. I mean, that's an obvious referral source for you right now to address posture of the rest of their family for whoever comes in to see you. Obviously, posture for us who are in the business of posture is a number one priority, but think about those family members, especially kids, that you can influence to come in for posture checkups and then teach them the principles that will last them a lifetime.
Absolutely. Get those instant referrals with Posture. Dr. Alan Chong, thank you so much for joining us on the Virtual Ergonomics Summit. And to all of our viewers, we acknowledge you and say thank you so much for being here and learning cutting-edge, revolutionary ways of treating your patients and helping them live better and happier lives by implementing simple ergonomic advice. Ergonomic design helps prevent postural decline. I'm Dr. Krista, founder of the American Posture Institute. Thanks for being with us on the Virtual Ergonomics Summit, and we'll see you in the next masterclass.